Greetings to Madam Azlina. So I'm going to present about influenza A H1N1. So my name is Niranchane Muniamdy, metric number 20611911003 from cohort BPS 13A. So this is the table of the content. For the first, we are going to talk about what is influenza AH1, and then continue by sign and symptoms, and then epidemiology of the disease, diagnosis, treatment and prevention of the disease, and conclusion. So what is influenza H1N1? The H1N1 flu, commonly known as swine flu, is primarily caused by the H1N1 strain of the flu influenza virus. H1N1 is a type of influenza A virus, and H1N1 is one of several flu virus strains that can cause the seasonal flu. Symptoms of the H1N1 flu are the same as those of the seasonal flu. In the spring of 2009, scientists recognized a particular strain of flu virus known as H1N1. This virus is a combination of viruses from pigs, birds, and humans that cause disease in humans. During the 2009 flu season, H1N1 caused a respiratory infection in humans that was commonly referred to as swine flu. Because so many people around the world got sick in 2009, the World Health Organization declared the H1N1 flu to be a pandemic. In August 2010, the World Health Organization declared the pandemic over. After the pandemic was over, the H1N1 flu virus became one of the strains that cause seasonal flu. So the signs and symptoms are: the symptoms of influenza A H1N1 flu virus in people include fever, cough, sore throat, runny nose or stuffy nose, body aches, headache, chills, and fatigue. Some people may have vomiting and diarrhea. People may be infected with the flu, including influenza A H1N1, and have respiratory symptoms without a fever. So the epidemiology of influenza A H1N1 is: on the middle of March, a new strain of flu virus similar to one seen in pigs was infecting humans in Mexico. And on middle of the April, the confirmed cases started popping out in the US and around the world. On June 11th, the World Health Organization officially declared the flu pandemic. As the flu was spreading, the World Health Organization named influenza type A H1N1 and now refers to it as pandemic H1N1 2009. So based on Ministry of Health of Malaysia, the total cases are 14,060 cases with 8 deaths. From 14,060 cases, 574 are imported cases and 886 are local cases. Almost 14,010 cases have been recovered. 27 cases are having antiviral treatment at hospital, and 10 of them in intensive care unit are having antiviral treatment at home. So these are the total cases from April to August 2019 in Malaysia. So as we see on the April month, there is no cases are reported, and continue by the May, there is one imported case are recorded, and from June, the cases are significantly increased until August, and it become a pandemic. So the potential of victim of H1N1 in Malaysia is children who is younger than 5 years old, pregnant women, people who aged 65 years old and above, adults and children with immunosuppressants due to medication or HIV infected person, Adults and children with asthma, chronic obstructive pulmonary disease, organ failure, cardiovascular disease, and etc. And finally, residents of nursing homes and other chronic facilities people. So this is the statistics of influenza H1N1 in Malaysia. So if you see the statistics, all cases, this is two types of statistics. I got it from an article, and both are the cases are increased from beginning of the May. So it significantly increased until the influenza H1N1, it's become a pandemic. So what is the actions taken by the Ministry of Health of Malaysia is National Influenza Pandemic Preparedness Plan, time-bound guide for preparedness and response plan for influenza pandemic, health screening, carries out on passenger traveling to and from Mexico via sea, air, and land beginning April 17, 2009. They also introduced thermal scanners. The thermal scanners had been installed at the entry point of Kuala Lumpur International Airport, KLIA, the border of Thailand and Singapore following the start of the global alert on the flu. And they also provided quarantine rooms. Around 28 hospitals in Malaysia are allocated for quarantine, and they have stockpiled more than 2 million doses of Tamiflu for safety purpose as of May 2009. And followed by health declaration, the visitors and Malaysians who are returning from abroad will be required to fill the health declaration form. And finally, mask use. The Minister of Health of Malaysia urged the people to wear a mask showing the symptom of the flu. So the diagnosis. The diagnosis of influenza A H1N1 is the doctor will conduct a physical exam, looks for signs and symptoms of influenza, including H1N1 flu, and possibly order a test that detects influenza viruses such as H1N1. There are several tests used to diagnose influenza, but not everyone who has the flu needs to be tested. The doctor may diagnose you with influenza based on your sign and symptoms. In most cases, knowing that someone has the flu doesn't change the treatment plan. So the next is treatment and prevention of influenza A H1N1. So antiviral medicines are an important tool in both controlling influenza by treating the patient's infection and helping to prevent severe illness that can result from flu, including bacterial pneumonia. When they're taken promptly, antiviral drugs can reduce the severity of the flu's worst symptoms and can shorten the length of the illness by an average of 1 day. Taking antiviral drugs early is especially important for people who are at high risk for flu complications, such as the elderly or people with compromised immune systems. Currently, there are 3 antiviral drugs recommended for treating the flu. One is Tamiflu, second is Relenza, third is Rapivac. These drugs work by interrupting the function of neuraminidase on the virus surface and preventing the release of viral particles from infected host cells. These drugs can treat cases of both influenza A and B and have the biggest impact when taken within 48 hours of the onset of flu symptoms. So rapid diagnosis and treatment are important. So these are the prevention of influenza A H1N1. There is 2 types of prevention. The first is non-pharmacological intervention. Personal protective measures, shielding your mouth and nose while you're coughing or sneezing. Frequently wash your hands with soaps. Isolation and social distancing, such as home quarantine, school closure, and cancellation of mass gathering. When we see pharmacological intervention, chemoprophylaxis. If the likelihood of complication is high, Tamiflu and Relenza may use as post-exposure chemoprophylaxis for affected individuals, respectively healthcare workers. And coming for the vaccinations, vaccine against the H1N1 virus is presently available in Malaysia. The first priority of all countries should be to immunize their healthcare worker. The next priority should be pregnant women. Inactive non-adjuvant vaccines similar to most seasonal influenza vaccine are considered the preferred option. So the conclusion of the disease is, although published data on influenza is limited, it is clear that influenza generates a considerable and underappreciated burden of disease in Malaysia. Following the pandemic, general awareness increased, and this trend should continue as more as affordable diagnostic assay become available. There are still many unknowns about the extent of the influenza pandemic in Malaysia. Public health and scientific activities are encouraged to fill these gaps as effective therapies like as vaccination and antivirals are available. That's all from me. Thank you.